uterine rupture. Okay guys, so let's talk about this. Let's define what's that. I'm going to talk over here very briefly. Uterine rupture is what you call a complete separation of the wall of the pregnant uterus. Okay, with or without the expulsion of fetus, okay, that endangers the life of mother or the fetus or both. So uterine rupture is nothing but is a complete separation of the walls of the pregnant uterus with or without expulsion of the fetus. Okay, that's the definition of what you call uterine rupture. There are two types. One is the complete and the incomplete. The complete and incomplete. Okay, what's a complete is if there's expulsion including the visceral peritoneum. Okay, or incomplete not including the peritoneum, no peritoneum. Okay, so remember this is uterine rupture is classified into the complete and the incomplete. So what are the risk factors? Okay, what are the risk factors? The most common risk factors is a previous classic uterine incision. Classic, very important, classic uterine incision. Okay, and the other causes, risk factors are myomectomy, if she has undergone a myomectomy, and excessive oxytocin stimulation, because that causes more contraction, severe contraction, results in the uterine rupture. Excessive oxytocin stimulation. Okay, excessive oxytocin. The other thing that can be seen in a grand multiparity, multipara, and if the uterus is what you call distended, it's more than normal. Uterus distension. Okay, so these are the risk factors. The most common is a classic uterine incision. Previous classic uterine incision, very important. Okay, all right. Now let's talk about what are the clinical presentation, how the patient presents, the clinical features. The most common findings are, remember, the vaginal bleeding. And then there's a loss of what you call electronic fetal heart rate signal. Loss of electronic FHR, fetal heart rate signals. Then the patient complains of abdominal pain, loss of station of fetal head, FH, fetal head. Let me write head, okay, because it can be a heart. Remember, the rupture of the uterine can take place during the labor or before the labor also. Okay, it all depends, right? If the patient has a previous classic uterine incision and it's about to rupture, the more pressure is applied, more oxytocin is given, then it can rupture before the delivery, before the labor. Okay, how would you diagnose that? Diagnosis is made by surgical exploration of the uterus and identifying the tear, right? That's it. So what is the significance? A vertical fundal uterine scar is 20 times more likely to rupture than low segment incision, remember. Okay, so vertical fundal uterine scar is 20 times, is it 20 times more likely to rupture than low segment incisions. So try to avoid those incisions. Okay, and how do you manage is really very important. That's nothing but surgical. Surgery is the treatment for that. Immediate delivery of the fetus is imperative. Okay, uterine repair is indicated in a stable young woman to conserve fertility. If you want to have a fertility, if you want to have kids, okay, then you have to repair and you can keep it up. If the patient is satisfied with the family, she doesn't want any more what you call it, uterus, then you can do hysterectomy. Okay, so this is really very important. Thank you so much for watching this video. Take care.